Well, all new at 5, local hospitals are strained and ICU beds are at a minimum as COVID-19 cases grow. And as our lead investigative reporter Matt Grant found out, local hospitals are preparing for another holiday surge.
Really, from day one, we've been planning for surge.
Dr. David Priest with Novant Health says hospitals are strained from a Thanksgiving surge.
This surge has been so large, we have had to use a good proportion of our hospital beds, including our ICU beds.
As cases go up, intensive care units are filling up. The New York Times found several intensive care units in the Charlotte area recently at or near capacity.
This most recent surge has seen younger patients that tended to be in regular hospital rooms, not needing ventilators, but needing to be in the hospital. So there's been some shift in that, which has saved us from having to use every one of our ICU beds.
Since the start of the pandemic, Novant has been planning to handle patient volumes 10 times normal levels. If ICUs fill up, Novant says hospital beds in its other facilities can be used, moving patients and staff around as needed. Each day, the number of beds, supplies, and ventilators are tracked. Priest says predictive models forecast what conditions will look like 2 weeks out so they can plan in advance. He says Novant is bracing for another holiday surge.
Right now, we have the capacity to care for those patients. Help us out by being socially distant, masking, washing hands, staying home, not traveling, not gathering in large groups, because as the virus spreads, those resources become more and more strained.
In Charlotte, Matt Grant, Fox 46.